All right. Well, welcome everyone. I think we're going to get started. My name is Devin Christensen. I'm the project manager of IPUMS PMA, and I am joined by two of my graduate students, San and Shelby. They'll be monitoring the Q&A while I'm talking. So this webinar is being recorded, so you will have a chance to come back and look at it later if you have to leave early. But anyway, thank you so much for joining us today. Our webinar is on how to use the performance monitoring for action data to link female survey data with service delivery provider data. So for this seminar or this webinar, I'll be using the IPUMS PMA data. So that is an integrated version of the performance monitoring for action data. Okay, here we go. So for those of you who are unfamiliar with the performance monitoring for action data, I'll briefly discuss what those data are, how IPUMS integrates the data, so what does integrated mean, and I'll also show you how to create data extracts for free on our website. Then we'll conclude with some examples of data manipulation and some really basic analysis using Stata. So if you use a statistical program other than Stata, this webinar will still be very helpful for you. We have example code for SAS, SPSS, and R on our website to do the same data manipulation. So you'll find that code on a user note on this topic, and I'll share that link with you at the end of this webinar. There will also be some time for some question and answer at the end of the webinar. And in a few business days, I'll compile the questions that were asked and post them with a recording of this webinar on IPUMS.org. I can also post some code at the same place if that will be helpful. And and this is the link where you'll find the recording. It's ipums.org/support/tutorials. But if you have questions during the webinar, please type your questions into the Q&A. And then we'll try to take a couple breaks to check on questions as they come up. First things first, what is IPUMS PMA? So I'm not sure how many people here have used IPUMS data before, if you've heard of PMA data before, but IPUMS PMA is the integrated version of performance monitoring for action. So this is a high frequency survey series that started in 2013. These surveys were initially conducted in 11 countries in Africa and Asia, and are currently fielded in 9. It was designed to monitor progress towards FB 2020 goals, and both the data collection conducted by a team at Johns Hopkins University in Baltimore with their in-country partners, and the integration efforts here at IPUMS are funded by the Bill and Melinda Gates Foundation. So here's a map of the 11 countries that we currently have data for. And you'll notice that there's a variety of the number of survey rounds conducted in each country. So notice that, so Indonesia is one of the countries for which we have data, but there's no future data collection planned. Also Cote d'Ivoire, that was their first survey round was in 2017. But other countries we have more rounds for. So IPUMS stands for Integrated Public Use Microdata Series. One of the most important things to remember is that receiving data from us is always free. We are grant funded by a number of federal government agencies so that our data can be used for free by the research community. We are based at the University of Minnesota Twin Cities. We provide harmonized variables and codes on an online data dissemination system, which contains systemized documentation at the sample and variable level. I'll be showing you all the data dissemination system in our web tour later on in this webinar. PMA data is collected at multiple units of analysis. Currently, there are household and female surveys, where each observation in the microdata is a person, and that's organized within households. The core female planning surveys are collected this way, in addition to nutrition modules that are collected in Burkina Faso and Kenya. So it's really unique about PMAs that also collects data from service delivery points such as hospitals, clinics, and pharmacies in the same small primary sampling units that the households were sampled from, so that you can also at the same kind of period of time, so that you can link these data together for both the family planning surveys and the nutrition module. So I'll be referring to these service delivery point surveys as the SDP data for short for the rest of the webinar. And lastly, there are surveys conducted in Ethiopia at the infant level in a maternal and newborn health module. So just a little bit about the sampling design. So PMA was collected using multi-stage stratified cluster sampling. So the first step for them was to work with the individual countries' national statistical agencies and divide each country or the sampling area into enumeration areas. And that's where we get this, we call these the EAs, these small areas that we can link between the females and the service delivery points. So they stratified these EAs into different groups, such as like urban and rural or by like subnational region. And they took a random sample of these AEAs. And these AEAs are rather small, about 200 households, and they sample about 35. I know that there's some difference across countries for the exact number of households or exact number of households selected. But there's a household roster interview where the interviewer gets the information on everybody living in the household, the composition, and then they return if there are women between the ages of 15 and 49. So each person level data file contains normalized survey weights to estimate indicators that are representative of the target population. So women ages 15 to 49. For example, like India samples, they've only collected data from Rajasthan. So using those weights, those samples will be representative of Rajasthan, but Ethiopian samples tend to be nationally representative, just as examples. So the goals of today's webinar is for us to add information about the service context, family planning service context, onto the woman's record. So the two examples these are really, really basic. We're going to count the number of health facilities that are in her small EA, in her small community area. We're also going to count the number of facilities that provide family planning. And then we're going to do a simple testing of association between the service context and a particular individual woman's health outcomes. You don't necessarily have to just count number of facilities. You can also do so many different types of calculate percentages or just binary indicators. Was there a stock out in her area? There are lots of options, and this is just one very accessible option for us to introduce you all to. So I think right now I'm going to stop for questions before I keep going. Shelby and San, are there any questions we should stop and talk about?
Yep, we have just a few questions in the Q&A, so I'll read them out loud to you, Devin.
Great, thank you.
The first question is the sampling design similar to what DHS has?
That is a great question. Yes, so I am not personally very familiar with DHS, but my understanding of the DHS is that this is a very similar sampling design. However, perhaps that is a really good question for the user forum. But my understanding is that it's very, very similar.
Okay. Another question is, are the data panel?
Okay, well, that's a little bit more of a complex answer. So the data that we're using today are not panel. These are repeated random cross sections. However, there has been a redesign, and starting in 2019, PMA will be following women in a panel. So we find that very exciting. We have the baseline survey on our website currently, and PMA is busy collecting those data now. So in the future, that's something to look forward to, but the data we have currently is not panel.
Another question is, does the data include childbearing women with disabilities?
Oh, that is a great question. Well, they don't specifically exclude women with disabilities, but there is no question about whether the woman has a disability. That's really interesting. So hopefully that makes sense. Just they don't exclude any women if they have a disability, but there's no way to identify women who might have a disability or research them specifically.
Another question is, do you have location data such as latitude and longitude for each household or enumeration area?
Okay. So there are no GPS data for households. That is not released for confidentiality. But you can go directly to PMA at pmadata.org, and you can request displaced GPS points of the geographic centroid of the EAs. And that is not available for every country. Off the top of my head, I do know that Nigeria does not provide any GPS data, but definitely Kenya, Burkina Faso, Ethiopia, and I can't remember all of them off the top of my head, but there are some available, and it's not through our site. It's directly through pmadata.org. So good question.
One final question we have now is, do we need weights to analyze this kind of data?
Yes, I would definitely recommend using the weights. We have a variable group called for weighting and estimation. So there are person level weights. We call them, our integrated name is FQ weight. And you can also choose to, if you want to get really accurate standard errors, you might want to cluster on EA or maybe Strata. I'm more of a data scientist than a statistician, so I won't be able to describe exactly the best statistical estimation techniques, but there are person level weights, and I definitely recommend that you use them. Let's see, there's a video tutorial on our website, and also a user note about which weights to use for which PMA files. So definitely look at our website. Also, if you're having trouble finding that, feel free to email our user support, and we'll share what the user support email is if you have more questions about weighting. Okay, are those all the questions, Shelby?
Yep, those are all the questions. And I just have a final follow-up related to the DHS question that was posed, that we can confirm that the sampling frame for PMA is a two-stage cluster design, which is the same as DHS.
Oh, yes, it is a two-stage.
And that's all we have for questions at this point.
Okay, great. Thank you so much. Okay. Well, what we're going to do now is I'll bring us to the PMA website, and we're going to create a data extract. And in order to create a data extract, you'll need to register an account. So you'll notice I'm already logged in, but the first time you come to our website, you'll want to register an account with us, and it's totally free. Basically, you just have to let us know who you are. Tell us a little bit about how you plan to use the data. I'll read your research description. We just want to make sure that these data are being used appropriately and for non-commercial purposes. It also helps us know how often our data are being used. Excellent. Okay, so what you would do is you register an account. When your account is approved, you'll receive an email from us, and then you can log in using the username and password that you chose. So I'm going to go to the select data area. This is our online data dissemination system. So I'm going to start with creating the person level data. And you'll see you have many options here. So here are nutrition data, the maternal and newborn health data, family planning service delivery point, and family planning person. So I'll start with the person level. And the samples I'm going to select are from Nigeria. I'm going to grab a few rounds of that. I'm going to make sure I'm choosing nationally representative ones. You'll see there's these little purple icons, and you can hover over them and get a little bit more information. So this sample here was only from the Oyo region of Nigeria. But if they don't have a little icon next to them, you can be assured that they are nationally representative. And before I submit my sample selections, I'm going to keep the default case selection here. So in original PMA data, they include households and females who either did not complete or refused, or for whatever reason were sampled but did not complete the questionnaire. So if I chose this option, I would include women who declined or were not available to be interviewed. But I just want to keep the cases of women who were eligible for that female survey and completed their survey. So I'm going to add submit my selections. And I'm going to choose two variables for our health outcomes. So first, I'm interested perhaps in whether the woman has visited a health facility for like a healthcare visit in the past year. That might be an interesting indicator. So when women are participating in healthcare. I'm also going to look at whether the woman is currently using a modern method of contraception. So I'm going to add MCP, so modern contraceptive user. And if I wanted to know more about either of these variables, I would click on the name, and I can go in here and look at a case count view of the samples I've selected to get a sense of, before I even add it to my extract, how many women are or are not using family planning. I can also look at all the documentation, a description about how this variable is calculated, or maybe if there was a question. This one is a calculated one, so it doesn't have questionnaire text with it. But we also have the universe of the question, basically who was asked this question. Lots of information at each of these variable level metadata, basically. So another thing we'll need to be pretty careful about is we need some technical information about the women. So if we wanted to add some weights, like the question we had before, here's your female level weight. So that'll be a normalized individual level weight. And if you are pooling across countries, you may be interested in adding pop weight, which is something that we have calculated based on FQ weight. And I'm not adding this one because it's already pre-selected here. But if we wanted to pool multiple countries together, and it just controls for the representative population of women from 15 to 49, so that you have a more accurate estimate across. And there's more information on our website if you want to know a bit more about those weights. Okay, excellent. Another thing we'll need to know, and I know offhand that my indicator variables like the EA, these are all pre-selected for me because I want to know the EA the woman is living in, and I also need to know the sample, like which survey round, so that I can connect it to the appropriate STP. But all of these are pre-selected. So I have all the variables and samples I want. I'll go to View Cart. I'm going to review, make sure the variables I chose are here. And we also have a video tutorial about how to use our extract system. So if I'm going a little too fast, you can find some videos on our website or ask us questions via our user support. All right, so I'm a Stata user. So I like to have my format in Stata. But if you are not, if you want it in SPSS or SAS or CSV, you have many options here. I'm going to keep it at Stata. And I'm going to say this is the female data for the webinar. So I'll submit my extract. Excellent. So while it's processing, I'm going to go back and I'm going to create my service delivery point data set. So I'm going to change this to make sure I've got the family planning SDP data here. And what I want to know is whether whether each facility provides family planning services at all. So I'm going to navigate through these variable groups. And I know that the variable name is FP offered. Of course, you can always search and find your variables in another way. And then I need to make sure I select samples. So I need to grab the same rounds I did before. So we had grabbed 5, 4, and 3. In this case, I'm going to choose all cases rather than just facilities who responded, because I want to make sure I'm counting a hospital or a clinic, even if they didn't have any staff who had a bit of time to answer the interview. Maybe all of their staff were really busy helping clients and patients, and they couldn't have an interview, but I still want to count them. Still want to know if they're in that EA. So I'm going to submit the sample selections. And again, the technical variables, I need to merge them. I know that they're already present here. That's just because I know that I set them as pre-selected. So I'm going to view the cart. I'm going to create my data extract. Now this is the SDP data for the webinar. Excellent. So this one has already finished, and this one is processing. So before we move on with opening up the data, I want to talk a little bit more conceptually about what we're about to do. So my first step is that I want to transform the format of the SDP files. So in order to have an appropriate match, I need to create a file. I need to create data at the EA level. So let's say we have this hypothetical sample of 7 facilities within 3 EAs. And I know that there are 2 facilities in both EAA and EAC. And then there are 3 facilities in B. One moment. Okay. So, and you'll notice that all of the facilities except for facility 6 were interviewed. And in order to indicate to our users, hey, we don't have any information about whether facility 6 offers family planning or not, we'll code it as a 90 for just saying it's missing because they weren't interviewed. But we still want to know that there are 2 facilities that are located in C. So the way that I'm going to I'll be using the Stata collapse command because I just want 1 observation per EA. And I'm going to calculate that in EA A, there are 2 SDPs, but only one of them offers family planning. In B, there are 3 facilities, and only 2 of them offer family planning. And in C, we know that there are 2, but we don't actually know if either of them offers family planning, but I'm going to count that as a 0, just because we don't have that data. And then the second step, after we've collapsed the service delivery point data down to the EA level, we're going to attach it to female records. So let's say also in this hypothetical data example, we have 7 women in the female sample, and we know their age, and we also know the EA where she lives. So in these same areas, we already know all the service contexts that we're interested in. So we're going to attach one for offers FP to the 2 women who live in EA, in A, and then also that there are 2 facilities there. And you'll notice that there's a woman who lives in D, but there wasn't any facility interviewed or sampled in EA D. One thing, so I wanted you to think about, like, what does that mean? It could be that there are no facilities there. It could mean that that they just weren't interviewed, or so Stata will have a missing value for these 2 indicators here, and you have to think about, do we keep them as missing, or do we count them as 0? But I'll talk about that a little bit later. Okay, so this might be a really good time also to stop for questions if people have any kind of thoughts or misunderstanding. Maybe like not everything is totally clear about that conceptual idea of what we're about to do.
We don't have any new questions in the Q&A or the chat quite yet. Oh, one just came in. Let me read it to you.
Right.
The first question is, can we have the Stata codes as well? It is easier to follow with the codes. Thank you.
Oh, sure. So that's actually what I'm about to do. I'll be opening Stata up. So the Stata code is online.
Devin, I'll chime in briefly here and make sure we'll post the Stata code following the webinar for folks who want to follow along afterwards.
Yes, exactly. Okay, thank you very much. Yes, okay.
And then one other question we have is, do we know if the respondent of the surveyed facility accessing the services? Do we know if the respondent, I think, is the question?
Oh, I see. Okay. Well, that is one limitation. If I'm understanding the question correctly, the woman does not specify like the name of the facility that she has gone to. Is that the? Do you think that's kind of what they're getting at, Shelby?
I believe so. Yep. That it looks like that is the question. Yep.
Okay. Yes, I totally understand what you're thinking of. Maybe a research question that maybe you have. There is one paper that I think the first co-author, I think it was Schifferau. They had access to the like the non-public use GPS data, and they were able to do a bit of analysis on how far a woman was. Like they had the GPS data of the household to the GPS data of the service delivery point. I wish I could think of the title off the top of my head, but I knew it's Schifferau, and I think the year might be 2017, not entirely positive. That might actually be something I can post with our full Q&A answers on our website later. But they did something really interesting where they they researched the physical distance, but they do not ask a woman like which facility you've been to or where, like which facility in particular you get your contraception method from. But there is a question in the data of whether the woman, if she is currently using family planning, the type of facility she went to, like was it a hospital, was it a pharmacy? But unfortunately, they do not say the actual name of the facility. Any other questions that came up?
We don't have any other questions, but I believe we have one hand raised. Um, I'm not sure if that question's already been answered, so maybe if you don't mind typing your question into the chat and we can talk through it.
Great. Well, maybe while they're typing, I will. I'll move ahead just a little bit, but definitely pipe up when another question comes up, because this took me a long time to get my head around, like how do you kind of use these data together that are at different levels of analysis. So what I'm doing right now is I've returned to the website, and you would find this page at My Data. So first I'm going to download the female data. So I'm going to put it into my little webinar folder here. And you'll notice it has the file extension .gz. And what that means is it's compressed. So you'll need to use a decompression software in order to make those files accessible. There's plenty of free versions out there. I personally use 7-zip. So I'm going to go to the place where I've downloaded my data. I'll decompress them using 7-zip. Excellent. Did that question pop up there, Shelby?
We have one new question in the chat, so this may be from the hand that was raised. And the question is, do you coordinate with the DHS at all for this PMA initiative? In your experience, have you found that the key stats are comparable?
Oh, this is a really good question for the PMA team themselves. So we just take the public use data that they've collected and processed with their in-country partners. So I'll actually be sharing these questions with people that I have worked with PMA to make sure we've answered the questions really thoroughly, like the ones that we'll post later. If memory serves, I know that they did compare their results to the most recent DHS of countries to make sure they were comparable. I know that they did some pretty rigorous tests, and I know that a lot of the questions are very closely worded to maximize the comparability. But I think the more to fully answer your question, I think I'd need to hear directly from PMA. Hopefully that answers your question for right now. Any others?
That's all we have right now.
Great. Okay. Thank you so much, Shelby. All right. So first, I'm going to open the SDP data. And I know it's the smaller one, just because there are fewer facilities, of course. So I'm going to just show you a little bit of like what these data look like. So we've got 3 rounds from Nigeria, right around 700 SDPs per sample. It's looking pretty good. So you might also want to know how many of these facilities offer family planning. Okay, I meant to do no frequency row, just so we could get, here we go. Okay, so it looks like a vast majority of these facilities do offer family planning, but there's a, non-negligible number who do not offer family planning. So that's pretty interesting. Maybe you want to see, okay, well, what type of facilities are in here? Got quite a few pharmacies, a lot of health centers, some hospitals, a small number of clinics, and maybe some other types of facilities. Now I want to open up, so I'm going to sort by the year and the EAID. I wanted to show you that if we actually open up these data, oh, shoot, I was hoping to do a little cleaner. Okay, so the year, the EAID, and whether they offer family planning. So you'll notice this should be really similar to that hypothetical example that I shared earlier in the webinar. So here's our EAID, and you'll see that there are multiple facilities per area, and we have individual responses on each of these facilities. So what I'm going to do, first of all, is remember how you could potentially get a 94 if they weren't interviewed. So what I want to do is I don't want them to count that facility is having family planning because we don't know. So I'm going to replace FP offered to be 0. We could also make it missing if you would like, but in case that is we don't have information on it, we want to make sure that we're not incorrectly counting these places as having family planning. And now I'm going to do that collapse feature. And I want to count the number of facilities that are in this area. Oh, I did skip a step. Okay. So one thing that I do, and I'm sure that there are more elegant ways of doing this, is I like to create this counter variable. So every facility just gets a number 1. That's just because I want to count how many are in an EA. Okay, so I want to count the number of facilities that are there. I want to count the number of facilities that have family planning. And I'm going to do this by the EA and also the sample. Excellent. So if I browse again, it should be the way that that we saw in our hypothetical example. So here's one sample, and there's only one EA for that sample. The label gets a little cut off, but you notice that this is 56606, and this is 56605. So these are probably different years. So this one is 2014. It's probably 2015, maybe. And then we have a number of facilities, and also the count, the number of facilities that offer family planning. So now that we have SDP data in the format that we want, I'm going to save it in a place where I would like to access it later. Actually, I probably just want to change the working directory. So just make sure that you know the directory that you're working in. Excellent. So now that I've changed my working directory, I can just say that this is stp data.dta. Excellent. And it just appeared in my folder. Now I can go back to the female data. Right, and let's take a look at how many women are in here. A little over 11,000 per sample. That is great. And then we can take a look at, well, how many of these women are using family planning? first sample looks like between about 13 and 16%. And keep in mind, these are unweighted. I feel like that's another step that might confuse things. These are non-weighted, non-representative estimates. This is all just for demonstration. But looks like within the sample, we've got 13 to 16% in each of these years that were survey rounds were conducted. And then we can also look at how many women had taken a trip to a health facility for a healthcare visit. So more than half of the women in each of these samples had gone to a health facility in the past 12 months, and that stays pretty consistent. Okay, one little tricky thing is that you see in the health visit, some women did not respond, and I'm planning to do a logistic regression later, so that's going to be a little complicated because it will expect to see only a 0 and a 1. So I'm going to recode those to missing just for the sake of this example. And I know off the top of my head that no response is 98. So we're just going to have those as missing net for now because the women did not answer. Same for whether the woman used contraception. There's a missing value for those. And I know that those are coded as 99s. I'm going to do the same thing for MCP. Just going to make this blank for right now. Okay, excellent. Now I'm going to do the merge. So we are merging many women to one EA based on where she lives and also which year the survey was conducted. So I'm also going to use that STP data that we just created. Excellent. Okay, so you'll see we have many matches here. That is great. But there are some non-matches. So this non-matched from master, that means that these are about 5,000 women who there wasn't a corresponding EA in the facility data. And that's that one example we talked about where a woman was living in D and there wasn't any facility data in D. So we can tentatively say that there are no facilities in her area, or at least no facilities that were sampled. Perhaps instead, she's served by a facility in a neighboring area. And the using non-matches are STPs that were no women were included in the household and female data. So it's up to you how you want to deal with these non-matches. You can choose to drop them, code the facility counts to 0. Another thing you might want to do, and I'll talk about this later, there's a series of variables that tell you whether a facility serves EAs that it's not located in. And that is not an example we're going to have time to go over today, but we do have some code on our website and some discussion about how to use that. So that in case a woman is surrounded by facilities that aren't in just her immediate geographic area, there are ways to account for that. So first, if I want to look at the relationship between the service context and whether the woman is currently using family planning, I'm going to do a logistical regression, and the dependent variable is whether she's using contraception. And then I'm going to see, well, is there any relationship with the number of facilities that offer family planning in her immediate area? Okay, so obviously there's a lot of there's a lot of context about like individual level characteristics. This is obviously a really simple example. However, it looks like there is a statistically significant, really small in magnitude, but there's an association, and maybe it warrants a little bit of digging there. Could be a lot of things going on, could be a lot of endogeneity, but this is an example of this is a female level characteristic, and this is her community level characteristic. The other example we talked about is whether this woman had gone to a facility in the past year, and I wonder if that has anything to do with how many facilities she has in her area. Is it easier for her to access those if she only has to walk, like a 10-minute walk versus she has to get on a bus for an hour? So I'm not seeing any statistical significance here. Doesn't mean that that's not maybe a characteristic that might be important if you control for all the other reasons that may affect whether she's gone to a healthcare visit in the last year. But anyway, these are very, very basic examples just to start getting you thinking about what could be possible. So I think we'll return back to presentation and discuss other options. Like the variables that you can use are if you're trying to get an understanding of facilities that are near the woman but not in her EA. They're called EA served, and they have a number from 1 to 42. So you can find those on our website and use our, and this is the link here. So pma.ipums.org/PMA/STP attach user note SHTML. I think maybe we can include that with the PDF that we post. There's a lot of links going at you today. So I'll make sure that everything that you might need, any resources that we've talked about today are accessible for you later. Another option for what you could do with these data is there's some really, really extensive data collection in the nutrition module, both at the person level and the STP level. You don't just have to use the family planning data. And if for some reason you have this idea where you want to predict something about the STP or the facility, like the likelihood they would provide a particular method based on like the community characteristics, like the demographics of the people living in the area, maybe you could summarize the female data down to the EA and attach to the STP records. I'm not sure if that's if that's something that would be helpful, but it is something you can do. Let's see, I think that was everything I had to say about this slide. Excellent. So this is our user support email, and they are incredibly responsive. But we also have lots of resources on our website, lots of like Q&A, lots of video tutorials, user notes. We're here to help you, and again, our data is free. So thank you so much for joining us today. Let's see, I think it's time for more questions. As a reminder, this webinar is being recorded, and this is the link where you can find the recording of this webinar and also our resources, the code, the PDFs of question and answer. So thank you so much for sticking with me and listening. I know your time is valuable. Thanks again for listening today. So Shelby or Sam, do you guys see any other questions coming up now or since the last time we checked in?
We don't have any new questions. We had some questions pop up as you were going through this data demo, and those have been answered in the Q&A. So we don't have anything new quite yet.
Awesome. Thank you so much for taking care of those as I was talking.
Mm-hmm.
Another resource that I can think of on our website, we also have some other data exercises And data exercise 2 has another example of attaching service delivery point data to female data. I believe it's calculating a mean number of days that they're out of stock of a particular method. There's a lot of ways that you can parse through. There's just so many ways that you can calculate indicators from the service delivery point down to the EA level. It's kind of overwhelming to think about it. Nice. Well, I think I'll just stick around for just another couple minutes in case people think of any other questions. We're actually getting close to 11, and I won't keep anyone past that, of course.
We just had one question come through, Devin.
Mm-hmm.
And it's, do IPUMS PMA and IPUMS International coordinate in terms of how the data are harmonized, et cetera?
Oh, that is a great question. We have definitely relied on the expertise of people at IPUMS International. We've used very similar integration at like using the education level variables. We have followed their example of how to integrate those across different education systems. Let's see here. There's not a lot of overlap in questions, but we definitely try to keep very similar coding schemes with IPUMS International, and it's obviously a very similar strategy and process that we go through for sure. So glad to hear that there's maybe an IPUMS International user with us today. That's great.
And then one more question just came through. On the top of your head, do you know if PMA includes variables on health expenditures on those family planning related services?
Oh, yes and no. They don't, because when I think expenditures, I think of they actually go through and kind of give, like this week I spent X, Congolese francs on this sort of item. But they do ask in a few samples of the female questionnaire, they do ask how much money you spent on fees the last time you I think it was like the last time that you received family planning service or product, like the fee that you paid that time. And then on the facility record, they do have a question for how much they charge for 1 unit of a method. So close, but not quite. I think that those variables on the person record would be under the family planning access group. Hopefully I've remembered that correctly, but hopefully that is helpful for your research question, but it's not exactly expenditures.
And then we just have one more question in the chat. And it is, can we calculate the exact number of population from the sample using the national weightage?
Oh, I mean, the word exact, not exact, but I did use the UN world population. I can't remember exactly what the name of it is, but we do have a user note on how pop weight was calculated and also a video on it. But I used UN population data to I used a ratio of the person weight, like the normalized person weight, so that you can have a very approximate estimate for if you use the population weight on, let's say, MCP, the variable we were using today, you might get a very approximate count of the number of women in Nigeria using family planning at the time of the interview. But I definitely would not use the word exact. These are really great questions, everyone. Thank you so much for being engaged with us and for thinking really critically about what you can do with the data. I think maybe we'll wait around for maybe one more question and then let everybody get on with their day. Thanks again for your attendance. Okay, well, maybe if there aren't any other questions, maybe we'll conclude here. And you can always get a hold of us. And again, the user form, which you can find on our help or contact us from the PMA website. There's some really great resources. We're here to help. We would like you to use our data. So we're going to help in any way we can. Have a great day, everyone. Thanks again for joining. Bye.